let's see. Recording in progress.
All right.
I love that it tells you that now. All right, so just to start, this is going to go on YouTube as content. So welcome everybody to Preventing Heartburn While You're Sleeping. I'm Lori Ledley, the founder and president of Valley Sleep Center. We have Andrew Nabors here with us, clinical sleep educator, and he is going to give us tips on how to prevent nighttime heartburn. Thank you, Andrew.
You're welcome. Thank you,
All
Lori.
yours. I'll be here on standby.
Awesome. Well, thank you, Lori, and welcome to the webinar. And I will, of course, heartburn while sleeping. That sounds like a lot of fun, waking up and just feeling like you have to vomit because you have stuff coming up. And heartburn's never something that we like to deal with ever, really. And there's definitely some links to just some simple, basic stuff. Dietary things that should or could be generally, you think, this is an obvious thing, this would cause my heartburn. And there's some sleep related things that can cause heartburn that not a lot of people connect the dots to where or why they get it. But we will find that, like, I'm seeing a patient in follow-up and they'll say, one thing that's happened is my heartburn's gone. I'm like, well, I got some reasons for that. And I'll discuss with them and, kind of put the puzzle pieces together for them. And then they're more or less like, oh, okay, cool. Just another benefit to helping my sleep. So I'll go through the presentation. And of course, if there's any questions, you can throw them in the chat, the Q&A. Otherwise, we'll get this moving. And if anybody has any questions, obviously, like I said, just drop them in the Q&A. All right. And let's get moving. Preventing heartburn while sleeping. Of course, picking the side with the green bell pepper. How about that? I'll conveniently throw that in there for Lori. And then, of course, the avocado. So some food-related stuff. Why is heartburn waking me up? Of course, people waking up with reflux may not directly put that in with a sleep disorder or a sleep disorder or sleep problem, but it's definitely something, the heartburn, the heat coming up through your chest, up in your guts, and even some people, of course, you got to get it out. Of course, we've probably learned the hard way that these symptoms, they can tend to be definitely worse, at bedtime or middle of sleeping. And then, of course, we can ask, why on earth am I getting this as a problem? There's, of course, several causes for heartburn while sleeping. It's just, particular foods and medications and such can cause it. And of course, the diagram gives you a general concept of, where the heartburn issue is taking place. Zero in on where that stomach is, okay? Where that is anatomically on the human body plays a role. Some causes for heartburn, of course, you can have high stress levels, obesity, smoking or drinking alcohol. Alcohol is a big one. I've noticed that one. Wearing tight-fitting clothes, there's a reason for that. I'll explain later. Large meals, pregnancy, Lori mentioned that, of course. And, acid reflux, general description or definition is a backward flow of stomach acid through the tube that connects your stomach, which is your esophagus. And it's occurred from leaking sphincter that's not closing between your stomach and your esophagus. Why is it waking me up? Well, according to Medical News Today, as a person swallows their food, it passes through the esophagus, and then it goes through a muscle called the esophageal sphincter. Okay, basically it closes off and acts as a valve to keep the food from going backwards. Okay. Sometimes it fails to close completely, allowing the food and stuff to go backwards. And then, of course, when this happens, heartburn. Some people get it when they're laying down. Others get it while they're sleeping. When we're eating, we generally can be sitting or standing up, and it helps kind of push the food down into the stomach and keeps it from going back. But when somebody eats, or while they're laying down, or just kind of goes and lays down right after they're done eating, gravity is not working in your favor, and then it causes the stomach acids to basically leak back up into the esophagus, and sometimes can come, of course, all the way up and out. This diagram, of course, shows the difference between the stomach on the left, where the esophagus and the stomach are connecting, where the esophageal sphincter is closed. Stomach acid does not leave. And then, of course, the diagram on the other side is where it's not closing completely. Of course, there could be a medical disorder where that actual sphincter is malfunctioning, causing acid reflux, or it could be food and different reasons. Okay. Now, diving into reflux-related apnea. Okay, how sleep apnea and acid reflux kind of bounce around on each other. Okay. The Sleep Foundation shared research that has identified a link between gastroesophageal reflux disease, Gerd, and obstructive sleep apnea. But it's kind of hard to figure out which one came first. Did the sleep apnea happen that causes the Gerd, or did the Gerd happen and then you have sleep apnea? Nobody can they haven't figured out that general dynamic, but anyone struggling with GERD understands the difficulties breathing associated with it, because you have stuff coming up and you're choking and coughing and gasping. Okay. People with obstructive sleep apnea tend to wake up more frequently at night. And of course, they may be experiencing their GERD related symptoms. Okay. So as I mentioned with the previous diagram, where they show where the stomach was located in the human body, it's very close to where your diaphragm's at. Okay. People who have sleep apnea and they're having a massive difficulty breathing, their breathing isn't passive. They're not breathing smooth. Passive breathing requires very little to any effort. Your diaphragm is just gradually dropping, allowing air to pass through the airway. Okay. When you throw obstructive sleep apnea in, you have something blocking. Something's more or less choking you. Okay. When a person struggles to breathe, we use accessory muscles to breathe. Those accessory muscles can be in our shoulders, in our chest, and our stomach. Okay. You can use stomach muscles to breathe. If you ever notice, when you breathe hard and fast, your stomach is going in and out. Okay. Now, what can potentially happen is now you're really, really aggressively using these stomach muscles, and you push up stomach acid, because you're trying to really force a breath in, and then the stomach acid comes out, and then you have acid reflux. Okay. Now, of course, there's other factors, limiting smoking and alcohol consumption, limiting obesity and changing your diet can also help, but treating your sleep apnea may be the link in the cog to getting rid of your acid reflux. Okay, because if your acid reflux is dived into the fact that you just don't breathe well while you're sleeping, fixing that problem can fix the initial problem. Of course, there's research and debate continues between the association between obstructive sleep apnea and gastric reflux, but a lot of times the conditions can be co-concur. And they can create obviously issues for a person where you're choking and gasping off your own spit, vomit, especially the worst case scenario, aspirating. You get aspirate, meaning that means you breathe it in, you breathe in your food, which can cause aspiration pneumonia and some significant sicknesses. It's definitely not something somebody wants to experience. So treating heartburn while sleeping, of course, lifestyle changes, i.e. using a CPAP, that can help in reducing spicy, acidic foods, maintaining healthy weight, quitting alcohol, avoiding alcohol consumption during bedtime. Some others include these homeopathic methods, baking soda that helps counteract the acid process. Apple cider vinegar is another base that will help kind of scrap that. Ginger is really nice in our stomach. Apparently mustard, I don't even know what slippery elm is. Somebody Google that for me. Pickle juice, I'm not going to be drinking that before bed, but go for it. Aloe vera juice sounds fun. And fennel and almonds. Those are some homeopathic helpful methods to treat heartburn. Now, some other methods to help prevent heartburn while sleeping is obviously avoid eating late. If you eat towards bedtime or right at bedtime, your stomach's not having enough time to digest. I've run into that issue myself. It's like either eat spicy foods late at night or eat later at night. And I can just feel it in my stomach. And it's like, yeah, dummy, you just did, why that happened. Sleeping on your left side anatomically puts your stomach at a different angle and allows your body to digest better. Okay, it helps prevent acid reflux. Raising the head of the bed, okay, because when we lay flat, our body can, it's, everything's generally in some variation of a straight line, and the acid could slide forward and up. Okay, when you sleep at an incline, you're kind of pushing it backwards and such. Avoiding excess caffeine or alcohol before bed. Like if you drink coffee before bed, that can hit pretty heavy in your stomach. And I mean, drinking coffee before bed is probably not on the top of the list of people's things to do, but crazier things happen. Alcohol before bed seems a lot more reasonable. People tend to do that more often. Some over-the-counter medications like antacids help the relief of the issue, just Tums and stuff. But Tums is like a chalk. It's not something we should be consuming often. It can have a negative effect as well. Omeprazole and Pepsid, those can be prescribed by a doctor. Improving posture, sitting upright, not slouching, can help. The form-fitting clothes puts pressure on your stomach. Like, I don't know why somebody would be sleeping with like a girdle or something around their stomach, or even like one of those tight-fitting like Under Armour shirts, but maybe somebody likes to do that because it's cold or something, but that can put too much pressure on your stomach or chest and abdomen. So we have a couple combinations of good and bad foods. Of course, we want to avoid less fatty foods and alcohol, the coffee, the wine, fast foods, anything that can digest to be pretty acidic. Spices are obvious, dairy and such can be really tough on our stomach. And on the good side, you got things like ginger and greens and celery, the avocados, apples and pears and bananas, stuff that's easier on our stomach, stuff that can be easier to digest. So it's always best to keep track of any symptoms. Of course, if they're happening in the middle of the night and you have sleep apnea or you suspect you have sleep apnea, treating your sleep apnea can fix the issue. Okay. If you have certain triggers to trigger acid reflux, obviously avoid them. If you were to tell me you have a glass of wine before bed and you get acid reflux, I'm going to be telling you probably don't do that. Again, sometimes we are victims of our own habits. I talk about patients all the time. Oftentimes, nighttime reflux is undiagnosed, and until it's a problem, when it's burning holes in your esophagus, and now it's causing even more significant issues by leaking food into your spaces outside the esophagus in your stomach in places where it should be. Keep track of acid reflux apnea occurrences. If you're choking and gasping and having something come up, definitely consult with your doctor for a treatment plan. You can always schedule an appointment with one of our sleep specialists, and we can hopefully guide you to a better night's sleep, which will guide you to a better daytime effect. And thank you very much.